Hi, my name is Summer. I'm Dr. Alan Greenberg's medical assistant. Today I'm making an educational video to explain to you how to take care of your lipo holes and the drainage after the procedure. And today I have Courtney here to be my little model to help me demonstrate this for you. During the procedure we use what is called a local anesthetic called tumescent. It has lidocaine, epinephrine, and sodium bicarb in a 1,000 milliliter saline bag. We put about 6 of these into the abdomen to numb that whole area. So this is what you'll be draining out. It's kind of hard to explain how much drainage, but if you can just imagine having 6 of these, they're going to all come through these little incisions about the size of the markings that I have put on here. We do leave 3 open. They're going to be much lower. From this prevents us from having to use any drains like you would for traditional. But now you have to take care of the drainage that you're going to have for anywhere from 24 to 72 hours. If you do have it up to 72 hours, it's going to be light spotting versus full drainage, but the first day is overwhelming. So in your bag, we will include most of the supplies, if not all, that you'll need for your aftercare. In the bag, we will include the maxi pads, and we'll show you again how to use those. We also have arnica gel, not something that you have to have, but it's used for bruising. You'll just apply it to the whole area like lotion a couple times a day. As long as you have any kind of bruising, that'll be beneficial. Once the drainage stops, you'll still have the holes and they'll need to be protected so they don't get any bacteria or anything inside them. We also want to keep it hydrated to prevent any scabbing. Preventing the scab allows it to heal from the inside out, which would minimize any discoloration or scarring that you may get from it. So by doing this, we'll have you put a little bit of Vaseline over the hole along with a little circular band-aid to hold that Vaseline in place until it's healed, which usually takes about a week for it to fully close. We also give you, the day of your pre-op, we'll give you a purple folder. In this purple folder is going to have all of your before, aftercare instructions. Everything that I'm going over this video will also be in here. We also include on one of the sheets at the post-op care, you'll have the physician's cell phone number, so you'll always be able to contact him as well. Okay, so I'm going to start with the garment. We do get it from a company called Design Braun Inc. You are able to go to their website and purchase an additional one if you would like, but we do include one with the whole procedure. So I'm going to explain how that works. We do expect you to wear that for the first 3 weeks around the clock, and then after that at least 8 hours a day or during the night, whichever one is more comfortable for you. And this will help with the overall skin tightening of the procedure at that point. But the very beginning is going to prevent any health risks that are involved with any of the drainage. So very important again that you wear this around the clock for the first 3 weeks. But first I will go back to Courtney and show you how to actually cover up the incisions. So the day of the procedure, we actually tape the maxi pads down to the skin just so they'll stay in place for us to get the garment on. But once you have the garment on, I'll show you a trick on how to change out the old ones and put new ones there. But if for any reason that's a little tricky, we do include tape, so you are able to do tape as well, just like we do. This is, again, not something you have to do at home, but the drainage is a lot at first, so I like to always double up the pads. So I just cut them in half and put it right on here, but again, you can leave it as whole, whichever one is easier for you. So the day of the procedure, when we are finished, before we put the garment on, we will put these pads over the 3 incisions that are left and just tape it down to the skin. And this is what we'll use to collect the drainage again. Okay. Now, due to a lot of the medications that we use to keep you comfortable through this procedure, you may feel really groggy at this point. So usually I have Kelly or someone else kind of help me get you into the garment. So at home, it's really important that there is somebody with you at least the first 2 days to kind of help you get in and out. Especially since this garment's so tight, there's a chance of you feeling lightheaded or dizzy when you go to take it off the first few times. So just kind of take your time getting out of it if you need to get out of it. And have something to sit on just in case you do feel that way. So right now Courtney's going to be able to help me a little bit more than what you would be able to, but she is going to put the garment on. Okay, so just for demonstration purposes, Courtney is leaving her clothes on, but most of the time you will not have anything on at this point. And the garment is designed for you to be able to use the restroom without having to take it on and off. It does have, you can't see it, but it does have an open crotch. So once it's on, it's on. It's going to be a second skin. At first you may not like this garment, but it's going to be your best friend towards the end. And I will have her turn around so you can see it. It does have a mesh design in some of the areas where we don't want compression or we don't want you to build up heat. All of this, we don't want compression on the behind, so it's all kind of made to shape the body just perfectly. Okay, so at home, this is the trick on changing out the old ones to the new ones. And as soon as you get home after the procedure, you're gonna already have to change them. That's how much drainage they end up having. Then probably about every 30 minutes to an hour, kind of check on it and see if you need to change it at that point. And then you'll kind of get an idea of how much it's slowing down at that point. But at home, you'll want to unzip it. It does have the hook and eyes again, so you'll just undo that. And at this point, you should be able to reach all the pads. So you're just going to reach into the garment. And at this point, they're still really numb. They're not going to feel anything that you're doing right now. If they do, it's more pressure and touch. You're not going to hurt anything. So just reach in there and grab the old ones and throw them away. So to replace that, this is usually what's easier for people at home to do than what I've done here in the office. But you'll just open up the maxi pad and just look for the incision and just put the new one down inside the garment. Once you get them all covered up, then you can go back and close up the garment. Okay, so I am going to do a quick recap of everything and then give you a few more important pointers to know that after the procedure to help care for yourself and your loved one if you're taking care of them. But I just like to thank Courtney for being my demonstration model so I can show you how all this stuff works. Okay, so at home, before you go home, we have a whole process of going over all the aftercare stuff with you again. We also will bring in your loved one or whoever is taking you home at this point. If it's a friend, neighbor, relative, we'll also go over with the post-op instructions as well, because at this point you may not remember everything that we tell you. So it's always nice to have a team of people to kind of help you out the first few days after the procedure. So we do include pain medicine and antibiotic, and also anxiety medications in with this procedure as well. At this point, the anxiety medicine is no longer needed unless you find trouble sleeping the first night or two. The most important thing is going to be the antibiotic and the pain medication, because we definitely want you to be comfortable after the procedure. But before you can take the pain medicine, we do ask for you to eat something that's very hearty, very high in protein, something that's going to sit on the stomach well, something that's not going to produce a lot of gas to that area as well. You want to avoid anything like that. But this will be the only time that we tell you to get something fatty, a burger, something that's going to really just sit with you well. So we do not want you to get nauseous after this procedure. And it's been so long since you've had anything to eat, it's going to be the most important thing that you do is to get something in your stomach right away. So once you leave here, that is what we're going to keep telling you, is to get something to eat. Once you get something to eat, you are more than welcome to have your pain medicine right then. We also have an anti-nausea medication that you would have already gotten from your pharmacy if you need that as well. And then towards the end of the night, you want to take that second dose of the antibiotic and just complete them until they're finished. The pain medicine, again, you can take every 4 to 6 hours, just kind of gauge how you're doing, but we definitely want you to have it in your system before the pain starts, at least the first few days, and then we'll see how you do after that. Well, thanks again for listening to me. My name is Summer. I'm Dr. Alan Greenberg's medical assistant. You do, again, have his cell phone number if you have any questions. Anything that I've said in this video will also, again, be on a piece of paper inside the purple folder in the very ridiculously cute bag that we provide for you. Also, I will provide my own cell phone number. If you have any questions, you'll be able to get a hold of any of us after the procedure. So thanks for watching.